Hello and welcome to today's webinar, Mobile Apps in Healthcare, How the Top 200 Organizations Use Apps. My name is Lisa and I'm your host today. I'm the lead researcher for healthcare app data and the head of content and creative in the marketing team here at Fliplet. Just a quick reminder to please ask us any questions or share any suggestions you have throughout the webinar, which can be done privately via the Q&A option at the bottom of your screen. We may not have time to answer them during the session, however, we will follow up with you afterwards. So our agenda for today is a summary of the research, some key findings and trends, a deep dive into the most popular apps, why healthcare organizations use Fliplet, and then following up with some recommended next steps. And we're aiming to come in at around 30 minutes today. So the summary of the research is the top 200 healthcare sector list from Yahoo Finance is where we found our data, and that is based on market cap value and excludes healthcare insurance organizations. We used public app stores, both Apple and Google, and also search engines. The data does exclude any web apps, web pages, widgets, or apps published internally or via private app stores or MDMs. And the research was conducted in June 2023. Our interpretation of the data, just a couple of notes. Categorization of apps has been taken by reviewing the app names and descriptions available in the app stores, and also the features and benefits of apps are also taken from the same place. So on to our key findings and trends. 56% of the top 200 healthcare organizations have apps published on app stores. So that's 113 organizations with at least one app published. We found a total of 500 unique apps published. Yes, I realize that does sound almost too perfect to be true, but I promise you that I didn't make it up. 288 of those were published on both App Store and Google Play. 106 were published on Apple App Store only, and another 106 were published on Google Play only. And there's an average of 4.5 apps created for each of the 113 organizations. If we now look at how these 500 apps are covered by the healthcare industries, you can see that the largest portion, accounting for 23.8% of the apps created, is dedicated to the medical devices industry. Next, we have drug manufacturers representing 19.4% of the total. Diagnostics and research comes in at 14.2%. Medical instrument supplies follow at 10.4%. Healthcare information services contribute 9.6% of the apps created, with specialty generic drug manufacturers accounting for 7% of the apps. Following up, we have biotechnology industry apps making 6.2% of the total. Medical care facilities have apps representing 6.6%, and medical distribution apps represent the smallest portion at 2.8%. Just a reminder to please ask any questions as we go through the webinar. So this next slide shows a correlation between the ranking of healthcare organizations and the number of apps they have developed. Higher ranked organizations tend to have a greater number of apps, highlighting their investment in digital healthcare solutions and technology-driven advancements. So only 1 out of the top 10 and 9 out of the top 50 have no apps published on public app stores. It's fair to say that app development and app creation is becoming a lot more accessible now. So we're hoping that now we have more healthcare organizations being able to use no-code and low-code solutions like Fliplet. Creating apps is far more accessible to organizations of all sizes. We'll come on to talk about how we're enabling more healthcare organizations to build out a suite of apps later on. Continuing with our analysis now, and let's take a look at the launch of apps by year. Here you can see a breakdown of the industries within healthcare that have adopted app development over the last 14 years. There is clearly a jump in the creation of apps in 2019, and this continues for the next 3 years, where you can see a significantly larger number of apps being launched by all industries within healthcare. What's really interesting is the drop-off in app creation so far this year. Whilst this may seem surprising, we believe that given the volume of apps created between 2019 and 2022, The top 200 healthcare organizations have built out the majority of their suite of apps, and that they're now focusing on ensuring they optimize and regularly update these apps rather than creating new ones. The data confirms this hypothesis, as nearly 60% of the 500 apps have been updated in the last 12 months since mid-2022. That being said, we are still in the middle of 2023, so we could still see this number increase over the next 6 months. And we do look forward to refreshing this report next year to see what happened. This will actually give organizations outside of the top 200 a really huge opportunity to create and publish apps based on the learnings from the data included in this report. So here's the top 10 organizations with the most number of apps published. 6 of the organizations are in the medical devices industry, 2 are in the health information services industry, 1 in diagnostics and research, and 1 in drug manufacturers, specialty generic. Now, let's take a look at the apps in the top 10 organizations have produced. We can see interesting correlations here among the top 10 healthcare organizations based on the total number of apps they have published. The data is shown as those who have published their apps on both Apple and Google App Stores, organizations that have published only on the App Store, and organizations that have published only on Google Play. IQVIA, the leading organization with 22 apps, they've published half of their apps on both the Apple and Google App Stores, and then have prioritized the remaining ones on Apple, suggesting that most of their user base for these apps are actually using Apple devices. Medtronic has a significant number of apps and has published most of them on both platforms. Merck, a prominent drug manufacturer, has a total of 15 apps, with a majority exclusively available on Google Play. This could indicate a strategic decision to prioritize the Android user base or specific features that are provided by the Google platform. Fresenius Medical Center, which operates medical care facilities, has 14 apps. They have a relatively balanced presence across both platforms. This approach allows them to cater to a broader user base and provide access to their apps on different devices. Among the top 10 organizations, the presence of both Apple and Google App Stores is relatively common, suggesting a recognition of the value in targeting users across multiple platforms. However, the specific distribution varies, with some organizations leaning more towards one platform based on their industry strategic considerations or user preferences. So based on the data here for the top 10 apps by review rating in Google Play, most of the apps have a review rating of 5 out of 5, with GoodRx Prescription Saver having a slightly lower rating of 4.8 out of 5. This is the oldest app, launched in 2012, with the rest being relatively new launches between 2019 and 2022. There is a fairly even split amongst app categories, with the only exception of health monitoring appearing twice. Medtronic has 2 apps listed, perhaps indicating their popularity on Google Play. There doesn't seem to be a direct correlation between the year of app release or the app category and the review rating. We can suggest that regular updates might contribute to higher user satisfaction, with 6 of the 10 apps being updated in the last 6 months. However, this isn't the only factor given that influences ratings. And newer apps seem to be updated more recently, potentially due to initial improvements and bug fixes, but could also be due to the type of app that they are. Moving on now to the most downloaded apps on Google Play. So some key insights that we can see here are the GoodRx Prescription Saver is the most popular app with over 10 million downloads. You may also remember that I've just mentioned it on the previous list of the top 10 review ratings. Quite an accolade to have 10 million downloads and achieve a 4.8 out of 5 review rating. Merck has the highest number of apps listed. 5 of their apps are the same app in different languages, including French, English, and Spanish. What's incredible is that they all have over 500,000 downloads each. Recent app updates potentially indicate an active development process, which could contribute to user acquisition and retention. There is a possible correlation between the age of an app, how recently it was updated, and the number of downloads. However, further analysis is required. Apps in the health information services industry tend to have more downloads than those in the other subcategories, hinting at a higher demand for health information services. Now, let's take a look at the most popular app categories. Leading the pack is the event category, with 13.8% of the apps being created for events. We found within that, 85% of the event apps were created for multiple event types, and only 15% were created for single or one-off events like conferences. Close behind, we have reference and information and patient support categories, each accounting for 11.8% of total apps. This underlines the growing demand for quick, reliable information and personalized healthcare support in the healthcare digital space. Next up is product information apps that have a 9.8% share. This really highlights how important it is to the healthcare industry to provide product details, information, and ordering capabilities to customers. Health monitoring apps make up 8.8% of the total. So these are apps' real-time health tracking capabilities. It's definitely a rising trend we've seen in the data, with significant growth in these areas over the past couple of years. Understandably, we also saw a peak over the COVID pandemic time, where people have become more conscious of their health and sought tools to monitor it. The learning category accounts for 5.6% of total usage, reflecting an ongoing desire for educational resources and skill enhancements through digital platforms. And then in the 2% to 2.8% range, we have things like calculator tools, practice management, mobile device management, and also augmented reality. Each of these categories, whilst not as popular as the others, still represent important sectors of this app market. So let's now take a look at the top 6 apps being created by healthcare. These are events, reference and information, patient support, product information, health monitoring, and learning. Please do ask any questions that come up for you as we go along. So event apps, these are apps that support events in person and or in virtual. The audience for these tends to be customers or staff, and the features you're looking at in an event app are event and schedule, a floor plan, directory of speakers and attendees, so listing event participants, including speakers, attendees, and exhibitors, having chats and discussions, a communication feature that enables users to interact with each other. This could be private messaging or group chats or even discussion forums. Notifications, really important for events to make sure that your attendees are all informed in real time. Multiple events. So some apps allow organizers to manage multiple events within the same platform. As I've said earlier, 85% of the apps created for events have all been for multiple events. Checking in and out, a feature for attendees to digitally sign in. There's no more need to have a piece of paper to do this. And having reports and analytics so that you can continually track and analyze your event data to optimize for the next event. Benefits of the event app include enhanced engagement, streamlined communication, real-time updates, and audience analytics. And a couple of good examples from the research include Dentsply Sirona events by Dentsply, and also GSK events from GSK. Reference and information apps. These are curated, reliable data and resources for quick on-demand information. Audiences tend to be customers and staff. And when we're looking at the features of these apps, you have a reference and document library, often a medical database within the healthcare industry. So they may provide access to extensive databases for medical information, including disease descriptions, symptoms, and treatments. The inclusion of multimedia content has become very prolific, such as procedural videos and images, including diagnostic tools. So some apps offer decision support tools that can exist with diagnosis based on input symptoms or test results. Medical calculators are also sometimes included within these apps, and they also are sometimes standalone. Clinical guidelines. So having access to clinical guidelines and best practice procedures to ensure the highest of quality care. Notifications and alerts are also key to make sure that your users are up to date with the most up-to-date information. Offline access, many apps offer offline functionality so that crucial medical information can be accessed even when your internet is not available, and real-time updates. So as I mentioned earlier, making sure that your regular updates are really followed up by people in the app. Benefits of a reference and information app include instant medical information access, enhanced patient education, facilitating clinical decision-making, and also promoting continuous learning. A couple of examples are NeuroDM from Biogen and Omnipod 5 simulator from Insulet. Next up, we have patient support apps coming in at 11.8%. These apps facilitate health management, provide resources, and enable professional communication. And the audience is usually customers or health practitioners and practices. The features include appointment scheduling, so users can book, reschedule, or cancel appointments directly through the app. Medication reminders, they can often include schedules with reminders to improve adherence to taking medication. Health information access, having access to personal health records or lab results, and medical histories. Secure messaging to be able to communicate between patients and healthcare providers is often a key feature within these apps. Telemedicine, having virtual consultation features, obviously very popular during COVID times when it wasn't possible to meet doctors in person. Patient community. Some apps have forums where patients can share experiences or provide mutual support. Health metrics tracking, with the ability to track and record health metrics like blood pressure, glucose levels, and weight, etc. And then also emergency assistance, so quick contact options for immediate medical assistance in case of emergencies. The benefits include that it simplifies health management, enhances provider communication, encourages treatment adherence, and facilitates remote consultation. A couple of examples from the data include Doximity from Doximity and MyPrivia from Privia Health Group. Coming in at 9.8% are the product information apps. So these are detailed searchable information and reviews about specific products. Your audience for these are often clients, customers, or sales reps. So the features of these are obviously a product catalog containing a detailed listing of your products, including descriptions, specifications, images, and sometimes prices. The ability to search and filter is key in an app like this so that you can find the product you're looking for based on categories, brands, price, or any other criteria. Multimedia content, videos, and images also very important to include. Product scanning, a lot of the apps that we saw have scan barcodes or QR code capabilities so that you can find the product that you have in front of you in the app very easily. Notifications and alerts, also very important. You can make your users aware of new healthcare products or any deals that have come available. You can include training information on products to ensure users know how to use the product properly. Ability to submit service requests on equipment, and also the ability to incorporate product ordering into your app. There were a number of apps that we researched that had either product information or ordering product capabilities. However, we're now seeing a trend towards incorporating both of these really easily into one app. The benefits of this type of app are that you have updated product information and guides, informed purchasing decisions, enhances patient empowerment, and the simplification of accessing product information and reordering. A couple of examples to highlight here are BD Infusate Companion from Becton Dixon, and also the Genius Thermometry from Cardinal Health. And the next one we're going to review is the Health Monitoring app. This is to track, analyze, and report personal health data. Audience of these is often customers or staff. So the features are data tracking. So these apps can track a wide range of health data such as steps, heart rate, sleep patterns, calories burned, and the list goes on. They can often integrate with wearables. So many health monitoring apps sync with your wearable device like your smartwatch or your fitness tracker to collect data. Goal setting, you can set personal health goals within the app, such as losing weight, increasing physical activity, or improving sleep. There's analytics and reports to help both you and your healthcare provider to understand trends over time. Personalized insights. So some apps have AI algorithms to provide personal health insights and recommendations based on the user's data. Notifications and alert can, alert users for abnormal data or reminders for activities such as drinking water or standing up. Health log, many apps do provide a space to log other health-related information and also sharing data. So really crucial for your relationship with a healthcare provider, personal trainer, or other family members. The benefits of these sorts of apps are personal health awareness, motivates healthy behavior, aids early disease detection, and enhances the doctor-patient communication. Some examples of these include the Dexcom G7 from Dexcom, which manages glucose levels, and EPSI for seizures and epilepsy from LivaNova. And the last app that we're going to take a deep dive into is the Learning app at 5.6%. These apps facilitate learning via interactive courses, tutorials, and educational resources. The audience is often customers and clients. So the features include course library, a wide range of courses or lessons across multiple subjects or skills, interactive content, like we've already talked about across a couple of the other examples. You can have multimedia lessons, including videos, audio lectures, infographics, quizzes, and even interactive simulations. You can track your progress through the app, understanding where you're at with all of your courses and the completed lessons that you've had. Discussion forums, potentially where you can speak to other learners so you can interact, ask questions, and open discussion topics. There's assessments and quizzes to regularly take these to test your understanding and reinforce the learning. Learning reminders via notifications to keep engagement with the app. Offline access, so the ability to download lessons and courses for offline learning wherever you are. The inclusion of certificates. So some apps offer certificates upon completion of a course, which can be added to a resume or a professional profile. And reporting, really important to understand how users are engaging with the app. Some benefits include self-paced learning, personalized education paths, enhancing skill development, and the convenience of learning access. A couple of examples to include here from the data are patient education from Fresenius and a PCR quest, which is actually a game from Thermo Fisher Scientific. So the types of app that we've just taken a look at to recap are events, reference and information, patient support, product information, health monitoring, and learning. So we have a growing number of healthcare organizations building apps with Fliplet. So let's just take a look at why healthcare organizations use Fliplet to create apps. So what is Fliplet first? So Fliplet is an online tool that enables anyone to very rapidly build apps. Apps from Fliplet can run anywhere across Apple, Android, and web. You create one version and it runs across all. Fliplet works with organizations to deliver a range of app solutions, including events, reference and information, learning, and community solutions. But why do organizations create their apps with Fliplet? Well, you can create a unique solution, unlike any of your competitors, including custom features and your own content. Our apps have enterprise-grade security. All information is encrypted and you can control who has access. White-labeled solutions, you can customize it to your company's brand guidelines. You can integrate with existing systems such as databases, electronic health record systems, payment gateways like Stripe, etc. You have the option to produce a public or a private solution, to publish on public app stores like the ones you've seen in the report today, or internal app stores such as MDMs. They work across desktop and mobile devices and compatible with all device sizes. You have offline capabilities as well, allowing users to interact with them in any setting. There are multiple use cases that can be created and included within one app or multiple apps, and it's really easy for non-technical staff to maintain the app. You can visit our website, fliplet.com, to find out more. So if you'd like to find out more about how healthcare organizations are using Fliplet, we have an ebook available which looks at 5 case studies of how apps are transforming healthcare. You can scan the QR code, download the ebook that's on screen now, and also we'll include the link in our email following this webinar. So where to from here? Well, our recommended next step is to, if you're new to apps, we really encourage you to consider the content, data, or processes that you already have in place that would benefit from being in an app. And also choosing an app from the app types that the top 200 healthcare organizations have created that I've just mentioned earlier. If you already have some apps, are there any apps in your app suite that are missing from the ones that most other organizations in the top 200 have? Consider the benefits you could gain from building out your apps. So I'd encourage you to log in to Fliplet Studio to start having a play with our pre-built solutions. If you haven't used Fliplet before, it's really easy and free to get started by going to fliplet.com/signup. From there, you can select the solution you want to create, add your own content, preview the app to share with your colleagues for review. Our Fliplet app consultants and support team are on hand via live chat to help you at any stage. Or if you prefer, you can request a demo. We'd be very happy to speak to you. You can request one of those via fliplet.com/request-demo. So a summary of today's webinar, we covered key findings and trends, the most popular apps analysis, why healthcare organizations use Fliplet, and our recommended next steps. We're currently building out the report and hope to send that out in the coming weeks. Now, I believe there might be some questions that have come through. I'm just going to see if we have a few more minutes we could answer those. Someone has said, really useful insights. Which app would you recommend starting out with as our first app? Well, what I would suggest is our research showed that events are the most popular. We know from experience at Fliplet that events are probably one of the easiest and simplest apps to build out. And you probably have a lot of examples already ready to go. So building out a prototype can actually only take you about 15 minutes. On the next slide, I'll actually show you a webinar that we ran a few weeks ago where my colleague Noel actually built out an event app prototype within 15 minutes. And so you can watch that and see how simple it could be. But that is one of the ones that I would definitely recommend getting started with. I think we've got time for one more question. So data security and patient privacy are critical concerns in healthcare. How do these top organizations ensure the protection of sensitive patient information within their mobile apps? Well, that's a really great question. The apps that you can build within Fliplet, but also others, will have encryption built into their app. Enterprise-grade security is really important. A lot of the apps have SSO capabilities as well, and being able to ensure that you can lock down and only allow customers or people that you allow to have access to your app. So a lot of healthcare organizations also train their employees on data security best practices and making sure that patients' privacy is paramount. And so just moving on to our last slide today. So just to let you know about a couple of the upcoming and on-demand webinars you might be interested in. And there's a couple to mark in your calendars for September: Unleashing the Power of App Promotion with some strategies to help you succeed once you've launched an app. And our next installment of our AI webinar series. This is the 5th one we've actually run, which will be an update to Fliplet's latest AI features in your apps. And as I mentioned, a few weeks ago, we ran a webinar about creating an event app prototype in 15 minutes. So we're always adding more webinars and events, which you can check out at fliplet.com/events. Well, that's all for our webinar today. Thank you so much for joining me, and I wish you all a wonderful rest of the day and hope to see you at another Fliplet webinar soon.